Dr Isabelle Adant is a general paediatrician, but also a metabolics fellow at the Royal Children's Hospital and the Royal Melbourne Hospital. So she works closely more with children, families, but also adults affected by lots of different rare metabolic conditions, but particularly this year, mitochondrial disease. As many of us know, food and nutrition are a big part of care and living well with Mito. However, knowing what to eat, what to avoid, and how to potentially manage your symptoms through diet can be overwhelming. As we mentioned, Dr Adant is also a recipient of a Mito Foundation Clinical Fellowship, and her year is focused on multidisciplinary care for people with Mito, with a particular focus on diet and nutrition. So in this session, Dr Adant will explain how the right nutrition strategies can support energy levels, reduce symptoms, and potentially improve overall well-being. And she'll talk about how these approaches can be adapted to suit different needs and different stages of life. Welcome.
Thank you for the lovely introduction, and thank you for the invite of speaking today. Maybe just as a kind of small introduction, my strange, not French, not Dutch, not German accent comes from Belgium, which means that I practically grew up eating fries, waffles, and chocolates, not drinking beer. So I'm not going to claim that I'm an expert in healthy eating in any ways. But in the past 6 months with the dietetics team at the metabolic team of the Children's in Melbourne, we've been focusing on how we can improve nutritional care for our patients with Mito. And we thought there might be a few tips and tricks we could share with you all. Most of it is not entirely based in good evidence, as you know, for almost everything in Mito, but there are a few groups that are looking into it and that have found similar things as we have been finding. So there might be more evidence coming as the time progresses. Just before we start, I want to acknowledge the fact that every journey is different, and that's particularly true for Mito, but that every life stage also comes with different needs and requirements, especially when you talk about diet. So this talk being very general, I can't give you like clear numbers of things you need to follow. I also know that some of you or some people you care for will need tube feeding and so on. So take what you can out of the talk, see what's interesting for you. And I also just would like to briefly mention that eating is so much more than just about the food that we put in our bodies. Meal times is a moment of connection to the people around us, but also connection to culture and religion. And it's also a moment of caring for the people we love or being cared for. And so I don't want you to leave the summit just medicalizing your diet. Those are really important part of food and meals. And if when thinking about food, about meals, it's mostly stress and anxiety that comes up, either because of physical symptoms such as pain, fear of choking, vomiting, or because of a need to count calories or really eat well, then I really encourage you to talk to your healthcare provider to try to find a solution to get some of that joy and that connection back. That being said, why is it important to eat well in Mito, and what are the things that we could try to improve by changing maybe little things in our diets? And I'm going to talk about strategies to try to improve energy levels, strategies to improve muscle and bone strength, some strategies to try to improve some of the gut symptoms we can have in Mito, and then if I have time left, just general healthy eating advice. It's quite straightforward why Mito impacts energy levels. Mitochondria, they're the main place where we transport what we eat, the energy we take from what we eat, into energy that can be used by the cells. And so looking at diet changes that we can do to improve energy levels, we want to choose food that's going to give longer and sustained energy. And the main thing around this is choosing what we call complex carbohydrates, or carbohydrates that have a lower glycemic index. The carbs in our food, they're the main source of energy for the body. That's also the easiest source of energy for our body. And they are let's say, crudely, two types of carbs, and it's best illustrated by this graph here, where you see going up the levels of blood sugar, and over time after a meal where we eat some carbohydrates. If we eat what we call simple carbohydrates, the one that have a high glycemic index, that are things like lollies, pastries, cookies, but also white rice, white pasta, and so on, then our sugars are going to go up quite quickly, and they might go very high, depending on how well our pancreas functions. And then after, the levels are going to go down, and they might go quite low. And this repeats after every meal, every snack. And so our allergy levels can really go up and down and up and down. When we choose for food that have a lower glycemic index of those complex carbohydrates, they take longer to be digested, and so they're going to be absorbed more slowly. And the result is that the sugars in our blood, they're still going to go up, but it's much slower, and they hopefully are not going to reach that same high peak, and then they're not going to go down as deeply. And instead of having a curve that goes really high up, high down, we're going to have something that's more stable. And that's hopefully going to contribute to more stable energy levels. Complex carbohydrates, I will come back to those sources after, but they're mostly found in whole meal grains, bread, pasta, rice, and so on. They're not always as tasty as the white pasta or white rice. So a few tricks to improve the glycemic index of your meal is by making sure that when you eat carbohydrates, you try to have a source of protein or fat or fiber in that same meal, because that will slow down your digestion and it will improve the release of those sugars. It will be a bit slower, and your sugars will go less high up and less down. So for longer lasting energy, we want to have maybe smaller meals, often with a small dose of complex carbohydrates. And if we do like those higher glycemic index foods, try to combine it with protein or fat. And as we're going to see after, protein is maybe a very good choice, so that we also work on increasing our protein intake. The second thing that can be affected in Mito, and where we can change a bit with the diet, is muscle strength. It's more difficult to build muscle when you have Mito, and because of those changing energy levels, it's sometimes also more difficult to have a strong contraction of those muscles. There are some changes we can make with diet, but diet on its own is not going to be the answer. Combining diet with some level of physical activity is going to be needed. And so to help building those muscles, we need proteins. Proteins, they're basically the building block of everything in our body, but muscles need a lot of protein. And I like to use the analogy of a train to describe protein. So a train is built out of different wagons. And to build a protein, you really need a lot of different wagons. In our body, there are about 20 of those different wagons. We also call them amino acids. And you need to make sure that you eat all of those amino acids as part of your diet. And so there are what we call high quality sources of protein. They're mostly animal proteins, so meat, fish, dairy, eggs. But soy is also a very good source, and so that's soy in soy drinks, in soy yogurt, in tofu, in soybeans, and so on, and then quinoa. If you would like to have a vegetarian diet, you can perfectly have a good amount of proteins, but you need to combine different sources. Use different vegetables, different legumes, have different colors in your plate to make sure that you're not missing one or two of those building blocks of those wagons, and that you then struggle to make those strong proteins in your body. What we have experienced in our clinic, and that's also been shown by other groups, is that people with Mito often don't eat enough protein. And our main recommendation has usually be try to include it in your snacks. We're really good to put protein in the main meals, like meat and 3 veggies. People don't forget, but your snack, those might be low in protein. If you like to have a fruit, that's fine, but add maybe some yogurt to your fruit. That way you have a protein and your regular snack. Or if you like a muesli bar, go for the high protein option. And that way you will slowly increase the amount of protein you eat just by changing your snacks a little bit. Eating enough protein is important, but you also need to just give the signal to those muscles to be strong. They're needed. And that's by staying active. And that's really within your own level of fitness. Doesn't need to be at the gym, can be regular walks. It can be some chair exercises. Try to work both on endurance, so things that just improve overall your how well you can like walk and sustain exercise, but also strength exercises. And if you need help finding a right program for you, you can ask your doctor or through the NDIS to have some funding for physiotherapy or exercise physiology. And after doing some exercise, have a serve of protein, high quality, and combine it with some carbohydrate to refuel the energy you have just used in that exercise session. Protein is also really important to have strong bones. And Mito increases the risk of a condition called osteoporosis, which basically means weak or brittle bones that can break more easily than in someone that doesn't have osteoporosis. So you might just fall from your own height and break your arm, for example. And to build strong bones, so maybe you've heard of osteoporosis mostly in women after menopause, but in Mito we also see men having osteoporosis and sometimes even children. So to have strong bones, you need protein, because that's the building block of our bones. We need calcium, and then we need vitamin D. That's the signal to put the calcium in your bones. And then again, you need physical activity to tell your body you need those bones to be strong. And calcium is usually, I mean, the best sources of calcium are dairy under all their forms, milk, but then I think as well as yogurt, cheeses, even ice cream if you want, and then fortified foods. Especially if you like all the vegetable drinks that replace dairy, oat yogurts, and so on. Read the label, make sure they're fortified in calcium. Not all brands have added calcium to their vegetable drinks. And it would be a bit sad to use those, like, for example, soy milk, thinking this is a source of calcium, but it doesn't have any calcium in there. If you don't like dairy or soy drinks and so on, then you can try eating things like sardines, anchovy with the bones. They will have a high amount of calcium. If you start relying on nuts like almond or green vegetables that people think have a high level of calcium, you need basically to eat between 8 and 10 cups of bok choy a day to get your calcium. I don't think anyone can do that. So if you really don't want to take dairy or fortified foods, you might need to rely on a supplement to get enough calcium. And then the best exercise to tell your bones to be strong are exercises where you have some kind of impact. So walking, if you can, jumping, and resistance training. Resistance training is using weights or a resistance band to get that extra stimulation on your bones. So swimming is a great exercise for a lot of things, but it's not the best one to improve your bone health. If you struggle to walk, try to see if you can stand at least a few times a day. That's why we also try, for example, for children that are wheelchair-bound to be in a standing frame and so on, because already having that weight on their bones will stimulate their bones to be stronger. And then there are a few diet changes that you can try to help with relieve some of the gut symptoms that happen in Mito. This might not work without help of medication and so on. Like Dr. Juliana said yesterday, it's very complex to improve gut symptoms in Mito. But especially if you have mild symptoms, some of those things could help. If the symptoms are more the lower gut with constipation, the main thing to look at is do you take enough water? Are you actually hydrated? Because otherwise our body is going to just try to remove as much possible water from our stools, and that's going to make them hard and dry and difficult to pass. So having enough water in your day, but water can also come from like soups and yogurt and things like that. They also have liquid in them, will help with softening the stools. Try to avoid things that are liquid but actually will dehydrate you, like alcohol and caffeine, because they won't help as much with keeping your bowel motion soft. And then keep active. Try to walk regularly a little bit to keep those bowels moving. There are some groups that have shown that having a diet that's actually low in fiber can help with constipation in Mito. Having a diet that's low in fiber, when you do it a little bit, that means making sure your fruits are peeled, that you don't have seeds or nuts in your diet. But if you want to go to a real low fiber diet, then you're actually going to cut out most vegetables and so on out of your diet. So that's not something you can do without help from a dietitian. Because you're going to have deficiencies that happen. So if you really have severe constipations, then there might be more things that can be done, but you really need help from a health professional to not have a diet that's not nutritionally adequate. And then if on the other, the problem is actually more on the upper gut, on the way you can swallow food or your stomach is digesting them, then the tricks around this are basically to try to remove some of the work that either our mouth has to do or our stomach. So the first steps of digesting food is to, what our mouth is doing is cutting them as small as possible and then mixing them with all the juices in our mouth and in our stomach to get them digested. By having food that's cut really, really finely, or even pureed or liquid food, we can take away some of the effort that our chewing muscles have to do and that our stomach has to do to digest food. And then trying to avoid everything that will slow down our stomach. And that's basically the advice I gave you to get into lower glycemic index foods. By adding fat, protein, and fiber to your meals, you will slow down stomach emptying. So if you avoid having high fat, high fiber, your stomach is going to work a little bit faster, and that's going to help. So you see, that's why it gets really difficult, because some of the advice actually is not going to help with those symptoms. And that's why if you really struggle enjoying food because it's too heavy on your stomach, talk to your doctor. There might be things at the level of medications that can be done, but it's a tricky symptom to improve. And then just in general, I'm thinking mostly about people that are carriers of the MELAS mutation, for example, but I don't have any symptoms. We just want to try to keep as healthy as possible, avoid other health problems. A lot of the advice for healthy eating in general will also help trying to prevent diabetes and so on. It's the best way to look at normal growth, to improve other chronic diseases. And that's actually something that we can do with the whole family. There is a very good guideline from the Australian government called Eat for Health. They have very visual examples. They also have on their website all the serves with the amount of serves of dairy, for example, every day to support your calcium. They also have some ways to try to improve the carbohydrates we eat. So it's a very valuable resource if you want to look a bit more into it. For people that have heard of special diets for Mito, I think that's really something that needs to be discussed one-on-one, like case per case with your doctor. For most people with Mito, diets that mimic fasting, such as intermittent fasting or ketogenic diet, are actually not a good fit because they induce more stress on the mitochondria. For very specific cases, there will be a good way to treat or manage some of the problems you see in that condition. And then diets like a vegan diet, where you cut out a lot of food items and food group, might also put your health a bit more at risk because they can come with nutritional deficiencies. So if you want to follow one of those special diets, talk to your specialist, ask for advice, see if you need to take extra supplements or extra monitoring to make sure it's a healthy diet for you. If you want to lose weight, having Mito, that's perfectly possible. Just avoid those crash diets. I think in general, they don't work. On the longer term, usually the quickest you lose your weight, the quickest it comes back. We want to aim for slow habit changes, things that will work on the longer term. So it's not going to come with a very speedy and impressive weight loss. But if you look back 1-2 years later, there will be some differences. And so try to change one habit at a time, making little changes that will have a meaningful effect on the longer term. And to lose weight, you need to eat less energy than what you're using every day. Just try to not cut down on your protein intake to keep those muscles. And the same way, try to stay active, because the one thing we don't want is to lose weight that's actually useful weight. We don't want to lose our muscles, we want to lose fat. And your best ally for this are probably vegetables and legumes. They are a very good source of a lot of vitamins, minerals, but they're also a good source of fiber. If you look at legumes and beans, they're a good source of protein too, and they're low in calories. And some people have this wrong idea that fresh vegetables are really the best. Snap frozen or even canned vegetables are also really, really good. They have a lot of vitamins. For the snap frozen ones, it's often better than the vegetables we buy that look fresh, but that have been stored in a shed for weeks to months before ending up in our stores. So have some in the freezers, have some in your pantry, just ready to go for those days where you don't feel like cooking and where we might want to go for those less healthy options, just so you have easy options to go. So those would be my take-home messages from today. If you want to work on your having more sustained energy levels, then try to look at having complex carbohydrates with a low glycemic index. For stronger bones and stronger muscles, we want to aim for good amount of protein, aim for that higher end of what's recommended for your age and activity levels. And we want to make sure we're eating enough calcium. And then water is a good place to start to improve constipation. And it's more the stomach, then it's really looking at smaller meals more regularly that are easy to chew. All of this will work better if you add some regular physical activity in your routine at your own level of fitness. If you want to take this further, there are some good fact sheets on the Mito Foundation website. I mentioned the Eat for Health website from the Australian government. If you want to look at complex carbohydrates and ideas to improve the glycemic index of food, then I recommend the Baker Institute for Heart and Diabetes. And then the International Osteoporosis Foundation has a very good calcium calculator when you can just enter in a week how much of cheese, milk, but also green vegetables, muesli, and so on do you eat. And then it kind of tells you, look, this is probably enough, this is probably way too low. And it could be a good place to start as well. And otherwise, see if you can get an advice from dietitians. That can be via your treating team. A lot of neurology team or metabolic teams have dietitians attached, or it can be through the NDIS or through your GP via a chronic health management plan.